CASPAR Trial, 2010. Exploring dual antiplatelet therapy in lower extremity bypass surgery. Welcome to today's episode, where we delve into the pivotal CASPAR trial from 2010, which examined the effectiveness of oral antiplatelet therapy for patients undergoing lower extremity bypass grafting due to peripheral arterial disease. The full title of the study is Efficacy of Oral Antiplatelet Therapy in Patients Undergoing Lower Extremity Bypass Grafting. The clopidogrel and acetylsalicylic acid in bypass surgery for peripheral arterial disease trial, published in the Journal of Vascular Surgery. Let us begin by outlining the principal objective of the CASPAR trial. Researchers aimed to determine whether combining clopidogrel, a well-known antiplatelet agent, with standard therapy using acetylsalicylic acid, commonly referred to as aspirin, could improve outcomes for patients who were undergoing below-knee bypass graft surgery for peripheral arterial disease. The focus was on whether this dual antiplatelet regimen could reduce the likelihood of graft occlusion, revascularization procedures, limb amputation, or death. In terms of study design, the CASPAR trial was a large-scale, multi-center investigation. It was randomized, double-blinded, and placebo-controlled, making it one of the most rigorous types of clinical trials. The trial enrolled 851 patients across 83 centers in 16 countries. Every participant received a daily dose of aspirin, which ranged from 75 to 100 milligrams. They were then randomly assigned to one of two groups. The first group received both aspirin and clopidogrel, while the second group received aspirin together with a placebo. The treatment and follow-up period extended for a minimum of 6 months and could last up to 2 years. Now, let us turn to the key findings. For the entire study population, the trial found no statistically significant difference between the two groups in reducing the composite outcome of graft occlusion, repeat revascularization, amputation, or death. In other words, the combination of clopidogrel and aspirin did not offer an overall advantage compared to aspirin alone. However, one notable result was that severe bleeding events were more frequent among those who received both medications. Specifically, the group taking dual therapy experienced severe bleeding at a rate of 5.4%, compared to 2.5% among those who received only aspirin. This difference was statistically significant. The CASPAR trial also included an important pre-planned subgroup analysis that revealed a critical distinction. For patients who received synthetic, also known as prosthetic, grafts rather than vein grafts, the combined therapy of clopidogrel and aspirin provided a meaningful benefit. In this subgroup, the rate of composite adverse events was significantly lower with dual antiplatelet therapy, 25.3% compared to 38.2% in the aspirin-only group. This translates to a relative risk reduction of 34%, and the number needed to treat to prevent one event was 8. The primary driver of this benefit was a reduction in graft occlusions. Importantly, while bleeding risk was increased overall with dual therapy, it was not statistically significant in the prosthetic graft subgroup. Conversely, for those patients who received vein grafts, adding clopidogrel did not confer any additional benefit. In fact, it only served to raise the risk of bleeding, without improving the clinical outcome. In summary, the CASPAR trial concluded that routinely prescribing clopidogrel in addition to aspirin for all patients undergoing below-knee bypass surgery is not supported by the evidence. However, for the specific group of patients who receive a prosthetic graft, dual antiplatelet therapy demonstrates clear efficacy in reducing graft failure and ischemic events, despite an accompanying increase in bleeding risk. This study fundamentally shifted the approach from a universal strategy for all patients to a more tailored method, where the type of graft material used determines the optimal antiplatelet regimen. Thank you for joining us for this exploration of the CASPAR trial. Stay tuned for further discussions on advances in vascular surgery and clinical research. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery podcast. Dissect the extraordinary.